Okay, next question. Big fan of the Ask the Doc series. I watch them all in numerous times, so I don't miss anything. Dr. Rand McClain is the man without a doubt. What are his thoughts for someone, obviously me, who is on TRT, 200 milligrams a week of testosterone cypionate, running SARMs or Austrian? Does he see any benefit to it all since being on TRT? Is there really any need? I'm now in my off season from competing in bodybuilding, and I'm looking to add some quality muscle. And to be honest, I'd like to stay away from anabolic steroids unless I'm in contest prep. Thanks, man. Big fan of the channel in general, Jason.
He didn't say his age in that, did he?
Nope.
But he did say he's on replacement therapy.
Right now, 200 megs a week of SIPs, yeah.
Yeah, which is a standard dose of testosterone cypionate, which I guess to get to the heart of the question, I wouldn't recommend any SARM.
What's SARMs?
Selective androgen receptor modulator.
Okay.
And Austrian is one that's a pretty popular one, and it's supposed to, hit the receptor like testosterone does and give you the same effects.
I see.
And there are some companies trying to promote it. I'm not sure what the status is in terms of legality at this point. But I am aware of some human studies. I know a doctor that went through some human studies, and I've seen the results. The problem with using SARMs, the results I've seen with SARMs, you can feel good. You can get the same type of effects you would with standard testosterone replacement therapy, like with cypionate, but what I see as a potential significant drawback is it drops your HDL significantly, kind of like Winstrol does. I always warn bodybuilders, if you're going to use Winstrol, know that you're going to cut your HDL in half within about 3 days.
Wow.
That's significant.
Mm-hmm.
And while I don't buy into the the cholesterol myth when it comes to it being the protagonist in building plaque, it just happens to be the component of plaque. There are studies that show, well, certainly we know that a higher HDL is going to help. I'm not going to give a lesson on HDL with a lot of things. It's something that's preferential. So, if he's already on TRT using something that's legal and is a standard and good dose, I mean, he's going to be at, because of the way it's dosed, probably be at about a little high, above high normal for half the week, a little below high normal for half the week, and average high normal is going to get great results safely. I wouldn't trade that for a SARM where you're, at a minimum, taking a chance with your HDL.
Gotcha.
And then, as far as I know, at least in this country, testosterone cypionate is going to be a lot cheaper also to get into practical aspects than buying SARMs. SARMs, I think, are for, again, I'm not, this is a couple of years ago, I remember these studies.
Mm-hmm.
Do you know their legal status today? I mean, the idea is, someone doesn't want to go to the doctor, or, someone who's too young to qualify is going to go buy SARMs at a major store, whose name I won't mention for reasons that will get us in trouble or whatever. But to just sidestep that. So if he's already gone to this process of being evaluated properly and is on a replacement dose,
Why bother? Yeah.
Bottom line is, why bother?
There you go. All right. Perfect. Thanks, Doc. Okay, Doc. Next question. Is it beneficial to take liver detoxifier while on orals, anabolics oral, I'm assuming, or should I wait until I'm done with the orals? Will the detoxifiers lower the effectiveness of the orals? And as a second part of the question, he says, also GH can cause insulin sensitivity and suppress the thyroid. So isn't it a good idea to supplement both insulin and T3 while on a GH cycle or prolonged GH cycle?
Okay, first part of the question. When they talk about toxification of the liver, I'm a little lost, because in not so much gym talk, but vitamin sales talk, you hear, or alternative medicine, which is not true alternative medicine, it's really fringe stuff. They use the term toxic. Arsenic is definitely toxic. It's in high dose, certainly a poison. I say in high dose because actually, a really, 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 really small dose, is supposed to be part of, our normal makeup because we get it, from certain sources. But what is not good for the liver, particularly with the use of anabolic steroids, is extra fat. A non-alcoholic, an alcoholic or non-alcoholic, fatty liver is a problem. What happens is guys who use hormone replacement therapy, because we're hitting a high normal amount, tend to be more likely to get fatty liver. Certainly guys that use an above high normal level of either testosterone or a steroid tend to develop fatty liver. Why? Well, we're trying to push muscle, we're trying to push the sugars into muscle. We're trying to create muscle glycogen, right? So you do that. What happens after the muscle's stuffed, if you will, saturated? Next step up in the chain of storage is your liver. And the old bodybuilders would take choline and inositol in high dose being about 3,000 milligrams a day. And I think we talked about this before, right? To rid the body of fatty liver. It's better than any pharmaceutical drug manufactured today for fatty liver. And if you talk to a good pharmacologist, you'll see them roll their eyes up, scratch their head, and say, "Yeah, actually, choline and inositol is better."
It's OTC. It's over the counter.
It's over the counter. They're both considered B vitamins. They're cheap as dirt. Again, certainly not getting a free toaster from Twin Lab, but I just know that there are a company out there that makes the highest strength I've seen, which is a 500 cap of choline and inositol. The only drawback to any of these products typically is the choline is in bitartrate form, which means that it tends to loosen the stool. So some people complain, "Hey man, now you gave me diarrhea," in which case you just take a little calcium to stop yourself up or compensate for it, okay? And you do that for 30 days, 3,000 milligrams of choline and inositol.
Of each?
Yeah.
Okay.
And you will squeeze that fatty liver clean.
Wow.
And it won't be toxic anymore.
How much calcium if you have sulfur stool?
Well, you can experiment with it. I mean, it doesn't happen to everybody, but I just throw that out there because I've seen people heard them complain about it. And nowadays, and I'm talking about, this is, a lot of my patients that are, say, 75 years old, old bodybuilders, will show me, on their list, on the intake form, the supplements they're taking. It'll include choline and inositol, and say, "Well, hey, why are you taking that?" And they'll say, and I don't want to name names, but, so-and-so, a famous bodybuilder, told me to take that, a long time ago. I don't even remember. I just take it because I know it's good for me. And we'll have the discussion, because I learned about it actually through, I have to give credit where credit is due, from Franco Columbu.
Wow.
He told me a long time ago that's what those guys were using. Of course, I followed up with the research, not because I didn't trust Franco, but because I just wanted to, learn more about it. And what they used to do is when when any of these bodybuilders that were using steroids would go on a cycle, they would use a 30-day dose of this high-dose choline and inositol, and to clean out the liver, just prophylactically, if you will. Now, today, what is recommended is to add one other ingredient, L-methionine, which is an amino acid which is liver protective. It's a methyl donor, but in about half the dose, 1,500 milligrams, and combine it all into one capsule that's loosely called a MIC cap, methionine inositolcholine. Mm-hmm. And that you can use to not only clean out the liver, but you can use it protectively also.
Wow.
One of the side effects is you'll notice, particularly, I don't mean to be necessarily gender specific, but most guys aren't concerned with softer skin, mm-hmm. but ladies are. They notice the smooth texture of the skin or the improvement in that, and they'll be on it and try the test.
Yeah, but at which point would you do it? Does it even matter, or do you have to do it after the cycle, during, or when?
Well, that's a good point. That's what I'm getting to next. So a lot of the standard has always been, after the cycle of steroids, use the choline and inositol for 30 days. But what about people who are on TRT?
That's right.
That's not you're supposed to be on this replacement dose.
That's right.
So what I recommend, and it all depends on, as in everything, what your diagnosis is and what your goal is. But every 3 months, just make sure the liver's clean. Obviously, doing a lot of cardio can help with that. It also depends upon your genetic tendencies. Some people have a tendency toward this non-alcoholic fatty liver disease. Depends on your diet. I mean, there's so many factors.
Yeah.
So we can look at oftentimes when you have fatty liver, your liver enzymes are mildly elevated. Like you might see an AST and an ALT of, 60, 70, 70, 80, something like that, as opposed to, in the hundreds or something. And that's when you're suspect. Of course, you can always ultrasound the liver to see if it looks fatty or not. Why bother? It's a fairly cheap supplement, and just go, hey, every quarter, make sure my liver's clean, keep my cardio levels up, don't eat too many sweets or too much beer and alcohol, and you should have a nice healthy liver. But that's better for you than well, I don't want to get into a certain type of match of comparing one or the other, but milk thistle is known to be liver protective. Mm-hmm. For what most of us are doing, athletes, and what we're talking about, this is way better for you than milk thistle.
Nice.
So I would spend the money on those supplements before I would milk thistle. Not that milk thistle is bad for you, just for an athlete's purpose. And I was going to say, a maintenance dose, I started talking about how girls will notice how their skin just looks better and feels better. So cut that back down to, say, 1,500 milligrams of choline and inositol on a daily basis forever. Like I say, it's a cheap and easy supplement to obtain.
So that would be okay?
Yeah.
Okay. That's a good question. Very nice, very nice. All right. Thanks, Doc. Okay. Hey, my name is Anthony, and I love the Ask the Doc series you produce on YouTube and Muscle Insider. I had a question and would love if you would be able to ask the doc for me on your next video. Thank you. So here's the question. Would testosterone and Anavar have any negative side effect on a person with Crohn's disease? I was operated in 2008 where a piece of my ileum was removed. Since the operation, I've been symptom-free and pain-free with very minor inflammation, which the GI doctor says nothing to worry about. Recently tore my pectoral tendon and wanted to get to its size and strength back. Thank you very much, Anthony.
So for Crohn's, is testosterone and Anavar going to negatively affect Crohn's? No, it shouldn't. Maybe the Anavar might upset the GI tract because it's an oral steroid and therefore has to be absorbed through the GI. And some people complain about stomach upset when they take Anavar. So that's just something to look out for, but not necessarily something that's probable. For Crohn's, though, some perhaps unsolicited advice, L-glutamine. Take your L-glutamine, 5 grams, 3 times a day, preferably on an empty stomach. If he's a bodybuilder, obviously empty stomach is hard to get to, but first thing in the morning, and hopefully last thing before bed, and then do your best somewhere in between, because L-glutamine's been proven time and time again. There's so many articles proving that it will help heal epithelial tissue. So this one's a no-brainer. You got to take your L-glutamine if you have Crohn's. Also, he mentioned pain, usually because the muscles will spasm around the lesions. Enterically coated, very important, so that it goes through the stomach and into the small intestine before it breaks apart. Enterically coated peppermint oil is very useful for reducing the pain. It relaxes the smooth muscle really, really well. Again, the all-natural is usually appealing to most, but it's over-the-counter and fairly cheap. Of course, you're not going to help yourself repair much of anything if you can't get food through your GI tract, so you want to keep it as healthy as you can. Now relating it to his part about trying to heal up his pectoral muscle, L-glutamine can help, as I said, heal epithelial tissue. It can only be helpful, and it's not expensive. And that trying to think if there was another question there about his using this stuff with Crohn's. I mean, if you're symptom free for the most part since 2008 with just a resection of the intestine, the ileum in this case, that's pretty fantastic.
Wow.
And also, I'll quickly add that there are a lot of studies surrounding a lot of research, I guess I should say, surrounding Crohn's. So keep your eye on the peer-reviewed research that's being performed right now, because we're making improvements with Crohn's. The GI Center over at Cedars here in Los Angeles Mark Pimentel is the head doctor, head of GI studies over there. He's doing a lot of work with IBS and IBD. You know, Crohn's is considered IBD. So, be on the lookout for improvements in diagnosis and treatment with Crohn's.
Nice. Yeah. Thank you so much, Doc.